the logic of making a product and the logic of making a service are very different. Making a service always requires two parties. Making a product, I could make and then sell it. But the issue of understanding the difference between making a product and making a service is what is underneath this idea of co-production. If we can integrate health and social services, we can increase the capability of people to co-produce good service. Now, in the process of doing this and examining it closely, we begin to understand the knowledge, the skill, the habits, and the willingness to be vulnerable that is involved in making a healthcare service, which after all is this combination of a relationship and an action. And it's holding those together in a way that actually creates better health that matters.
It was a privilege to work with a diverse group of people. We have theoreticians in this group, we have experienced health services researchers, we have quantitative researchers and qualitative researchers. But mostly I thought the question was an interesting and important question, and that I would learn so much from this talented group of people, and I have.
It was very heavy and I carried it.
Yeah.
But I thought you would enjoy this since you're such wonderful.
It's for ping pong.
It's an American ping pong paddle. Thank you.
Experience with working in our group and working with the Americans was very positive. I learned a lot and all kind of different things. I like the way that Brad has a certain kind of, and I don't mean that negatively, but simple logic. He just wants to know what you mean, how it goes, and not one or another fuzzy concept. I love that. All the Americans had their very, very strong points I learned from.
There was this acknowledgement that these differences were actually going to be helpful to us. But in order to access those differences, we had to respect each other. And we had to build confidence in each other's ability to understand what we were trying to do and how they could contribute to what we were trying to do. We met really frequently with the benefit of the internet, but even that doesn't give the kind of spectrum of human exchange that's really necessary for trusting, respecting, generative interaction. And so we had to get together face to face.
Having these meetings, face-to-face meetings, also doing social activities together with each other, starting the day with some stretch exercises, and also in addition to the formal side of doing the research, also the importance of the informal contact, it really enriches the quality of the research.
At the beginning, we were thinking about 3 types of chronic diseases, but as we got deeper into the problems, we concentrated on persons with chronic heart failure.
What we found was that despite our best efforts, the way that the data was collected in the 2 different settings really didn't allow for the kind of head-to-head comparison that we had hoped would be possible. The data could still be used to describe the circumstances in a profile or a signature way for the Dutch experience or the US experience. But the kind of head-to-head comparison of the quantitative data became really not possible.
We were in the middle of a process, and if a process, it's like a train, and I was in it. I wasn't able to correct where we were going to.
In theory, when we started this process, it sounded like it was going to be more simple than it actually turned out to be.
You know, I have been somewhat surprised about the challenges with comparing international data, because we read lots of studies where the researchers have made comparisons between their data in one country versus another. And so I was a little bit surprised about how challenging it was, which then makes me question a lot of these studies that have been published, and you know, and whether they have how they've dealt with the issues or not dealt with the issues.
I think can formulate on the basis of all these data, the qualitative data, what we call a kind of governing principles of co-production of a healing process. And I think the kind of healing process of people being confronted with chronic illness, it's not only about dealing with the disease, but it's dealing with your life.
I think we learned a lot about each other as people, and I think we learned a lot about the different healthcare systems and the patients that we take care of. These ideas of co-production and the social quality model, I think, can directly translate to the work that we do at both of our institutions.
At the beginning of medical school, there is focus on the patient as a person. Unfortunately, as you go through medical training, that focus kind of changes because there's just so much to learn, and you just have to get all that information, that medical knowledge in your brain, and that tends to push out some of the other things that are really important. You also start to think, well, I've just got to get through these check boxes, and then I don't really have time to talk to the patient.
When something like this happened, and you never had to really deal with it, and like I said, I never really been hospitalized or nothing like that, and so it was kind of a shock to me when they told me I had to retire from my job, and it just felt like it was the end, you know, you just want to give up.
And I think what working with the co-production team has helped me to do is to go back to the beginning of medical school and say, you know, actually getting that patient perspective allows me to be way more effective in helping the patient feel better, number one, and number two, creating a relationship.
The thing that keeps me going still to this day, not just then, are my family, my kids, my grandkids and stuff, you know, because now I got plenty of time to visit them. I understand you guys got a lot more patience, but when you take the time out and deal with one or two patients and just listen to what they feel, how they felt, what they've been through, well, that means a lot to them. You know, it's like somebody really cares. I don't know, overall I just feel happier now. I got a more positive attitude. I wake up in a better mood.
When I then ask a patient to do something, she trusts me. She knows, hey, if Dr. Carlson wants me to do this, there's a reason, and then we can have a discussion about that. It is much more therapeutic for both of us than me just checking my medical boxes.